presenting on a study titled Potential Interactions Between the Pathways to Diagnosis of HIV and Other STIs and HIV Self-Testing, Insights from a Qualitative Study of Gay, Bisexual, and Other Men Who Have Sex with Men in Singapore. So some highlights from this study. First is a qualitative study comprising in-depth interviews with 30 gay, bisexual, and other men who have sex with men, or GBMSM in Singapore. In terms of the context, firstly, what we did is we delineated the barriers and facilitators to HIV and other STI testing, as well as perceptions towards HIV self-testing or HIV-ST among GBMSM in Singapore, where HIV-ST had not been rolled out yet. In terms of our findings, we actually found that there will be, or we hypothesize that there will be an impact of HIV-ST on existing HIV and other STI testing patterns. Specifically, our key message is that HIV-ST might weaken linkages to clinic-based other STI testing if alternative strategies of promoting STI testing are not simultaneously rolled out. And in the next few slides, I will tell you how we came to that conclusion. In terms of our methods, we recruited 30 participants aged 18 to 39 years old who reflected the most at-risk subgroup of GBMSM in terms of HIV acquisition and other STI acquisition in Singapore. They had to be Singapore citizens or residents at the point of recruitment, and they were purposefully sampled to ensure that there was a diversity of different age groups, ethnicity, socioeconomic statuses, and sexual activity among participants. Our interviews were all guided by semi-structured topic guides, which covered topics on HIV-ST, factors to HIV and other STI testing. All the interviews were audio recorded and transcribed verbatim, and they were then analyzed through applied thematic analysis. So this is a summary of our findings. We actually found different motivators to testing, as well as barriers to testing for HIV, other STI, and we had one theme as well where we found that there were certain motivators specific to simultaneous HIV and other STI testing. These were all along the lines of internal motivators and external motivators, or internal and external barriers to testing. For example, in terms of motivators to testing for HIV, an internal motivator would be perceived susceptibility to HIV, of which we show some illustrative quotes here. Also, in terms of external motivators for testing for HIV, there was the power of social influence. You can see on the left over here that we had several sub-themes for motivators to test for HIV, which I won't cover in detail. There are also certain motivators to testing for other STI, but these were also quite different from that of HIV. So something that's shared between both is the perceived symptoms of HIV and other STI that applies to other STI, but something that is specific to other STI is a notification of STI diagnoses by sexual partners. We also found that there were several motivators to testing for both or testing simultaneously. They include examples of mandatory testing such as pre-employment checkups, as well as new relationships where individuals are incentivized to test for sort of like a clean slate for HIV and other STI before they enter a relationship. Participants also talked about how the availability of bundle tests, such as maybe going to the clinic for HIV testing, and there happens to be other STI testing as well. This when they get the opportunity to test for both. Something interesting was that we found specific motivators to HIV testing that could be a result of two factors. One is the heightened risk, susceptibility, and perceived severity of HIV among GBMSM, which led to HIV testing based on these factors. We also found that there were certain external motivators to HIV testing, such as social influence and accessibility to HIV testing services, that speak to the heightened alert and heightened community-based efforts to really push out HIV testing, and arguably sometimes at the expense of other STI testing. So what do these all mean? Basically, when we were to put this in a little bit of like a flow chart, on the left, we've got internal factors, we've got external factors in the middle, and we've got certain outcomes on the right. We see that there are certain pathways to clinic-based HIV testing, which is, or clinic-based STI testing, which are the only available forms of testing here in Singapore. We see that, the ones in the dark black arrows are what the ones that we hypothesize would be potentially affected by introducing HIV self-testing. What happens when we introduce HIV self-testing is people are more likely to perhaps forego clinic-based HIV testing to test at home or where it's convenient for them, and this might affect other STI testing, for bundle tests when testing for HIV as a result of motivators specific to HIV, and these include perceptions of heightened susceptibility and severity of HIV, as well as greater community and social influences to test for HIV. What the other arrows over here with the double lines, we hypothesize would not be affected. So the pathways to other STI testing that normally were exploiting the pathways through which HIV would be tested, might be affected if we were to implement HIV self-testing. All right, so what are our recommendations from this study? Firstly, in the absence of other STI self-testing, of course, what we would recommend is if HIV self-testing were to be implemented, we would actually suggest that we ensure that we roll out HIV self-testing alongside other STI testing strategies to mitigate the impact or the loss of opportunities to test for other STIs through bundle tests. For example, we might want to consider, community-based campaigns or efforts to really raise the profile of, the risks associated with other STI alongside HIV to get people to test at the facilities where STI testing is available. And of course, if HIV self-testing were to be rolled out, we would actually expect certain kinds of protocol, certain kinds of workflows to be put in place for HIV self-testing. We do hope as well that STI self-testing would be considered so that we can actually tap on and exploit the behavioral pathways through which HIV self-testing would be using to drive testing. With that, that's the end of the presentation, and thank you for your attention.